The long-running show Grey's Anatomy has made us laugh, cry, and question what we know about the world around us. At its core, the story is about the personal and professional lives of surgeons. But while saving lives every day and dealing with their emotional baggage, the doctors come across some truly unbelievable medical cases. So, beyond the tears, viewers experience shock at these fantastical diseases and accidents that can be borderline hilarious. It's true the show has many medical inaccuracies where they use MRI to observe a metal fork stuck in a patient's neck. Rookie mistake. Nonetheless, Grey's Anatomy is entertaining through and through. Where else have we seen a patient being dragged on a stretcher with tree branches for arms or being operated on with a live bomb inside them? Here are 10 such bizarre medical cases tacked by the surgeons of Grey Sloan Memorial Hospital. 10. Pregnant man. The atmosphere of episode 7 of season 2 was not dampened by Meredith and Derek's slump in their relationship as a medical miracle arrived at the then Seattle Grace Hospital that beat Mother Mary. In her third trimester, Tina is about to deliver her first child. However, her husband's focus does not seem to be on his future family planning. Shane Herman claims that he too is pregnant. The interns believe that he is mirroring his wife under unconscious sympathy. But the tables turn when the pregnancy test comes back positive. However, he was not technically pregnant. Duh. It was a rare tumor called a teratoma that grows hair, nails, and tissue, faking a fetus and releasing hormones that make pregnancy test positive. 9. Judy Doll's fetish. Perhaps the Enough is Enough episode should have been the waking call for writers when Mr. Hubble ate 10 Judy Doll heads, which caused a bowel obstruction. After Dr. Bailey discovered the figures in the imaging, viewers thought it would have been better if Hubble was a drug mule. Bailey extracted all the 10 Judy Doll heads during surgery. Izzy, George, and Christina, along with others, wondered over the patient's reason to swallow doll heads. When Mr. Hubble told Meredith about his fetish, viewers were shocked completely. 8. Two impaled by a pole together. A train accident brought mass casualties into the Seattle Grace Hospital in Season 2, Episode 6, titled Into You Like a Train. Bonnie Krasnoff and Tom Maynard were impaled by a train pole. The rod ran right through the patients. Although the plot ended very sadly with Bonnie's death, the improbability of the case cannot be ignored. Even the show's makers confessed that was absolutely fabricated. 7. Pain medication allergy fixed by pornography. Allergies are not unusual, but when Henry Lamott arrived, all eyes gawked wide open. In the Season 2 episode titled Bring the Pain, Lamott is allergic to all pain medication. To deal with the constant pain, his doctor has prescribed Lamott pornography, which, not surprisingly, works. That ought to be awkward for the medical team. 6. Penis fish. Ironies and puns swam deep into episode 21 of Season 3 titled Desire. Larry Jennings was brought to Dr. Fisher and Dr. Weber when a kangaroo fish swam up his urethra and obstructed bladder flow. The patient was not able to urinate for 3 days, and the bladder had to be relieved via a suprapubic catheter. Yeah, hellish fishtails. 5. Awkwardly stuck divorced couple. Divorces can be hard, and often one or both partners are stuck with the memory of their failed marriage. However, this former couple was stuck together more tangibly and shouted the title of the episode, Oh, the Guilt of Season 3. Sonia Kalman's IUD got stuck in her ex-husband Adam Morris during intercourse. They and the doctors had to go through an embarrassing imaging process with an even more embarrassing conversation with their daughter while being stuck. 4. Cement Man. Doing ridiculous pranks with friends is a memorable treat, and Andrew Langston will surely remember when he jumped in a vat of cement and almost died. In the Season 4 finale titled Freedom Part 2, Andrew arrives at the hospital enveloped in cement. Surprisingly, the chunk of cement around him was not the threatening issue. Andrew could have died if he could not relieve his bladder. 3. Woman with spontaneous orgasms. Pamela Calva's quality of life has deteriorated as she keeps having spontaneous orgasms multiple times over the past few months. In Season 2, Episode 18, titled Yesterday, Pamela and her father are both embarrassed as she climaxes in public. The improbable cases again make the plot of the show bizarre. Apparently, Pamela had a small tumor on her pudendal artery. The oversupply of blood to the clitoris caused spontaneous orgasms. The absurdity itself doesn't make us want to recall the treatment. 2. Girl who could hear her internal organs. Our body cleverly tunes out all the internal processes of the body. That is why we cannot feel the peristalsis of the intestines. But what if you could hear your internal organs? Haley May, played by Demi Lovato on Shiny Happy People episode, was incorrectly diagnosed with paranoid schizophrenia. Alex toils over the teenager's imaging and discovers that she has superior canal dehiscence syndrome, which left the teenager's inner ear unclosed. 1. The live bomb operation. This one has to be a medical alternate reality. In Season 2, Episode 16, James Carlson is sped into surgery when a bazooka shell crashes into his chest cavity. A brave new paramedic named Hannah Davies stops James from bleeding by putting her hand into his chest. However, her bravery melts away when Hannah discovers that the entire active bazooka is inside James and can go off at any moment. To make the scene more pressured, Derek is performing surgery on Dr. Bailey's husband, while Bailey is in labor, and Meredith takes Hannah's place. The intense narrative can't take away from the implausible case unfolding on the operating table. But Grey's Anatomy does everything in extreme right, be it family drama or far-fetched romances. They know how to push the boundary. So, some illogical and wild cases have made their way to the show's records, even if real doctors might smirk at them.